नमस्कार, मैं डॉक्टर सपना बंसल आप सभी का स्वागत करती हूँ आपके इस कार्यक्रम में एक पहल जिंदगी के नाम। आइए इस कार्यक्रम की विधिवत शुरुआत के लिए आई वुड लाइक टू कॉल अपॉन स्टेज चारू कालरा जी. शी विल प्रोसीड. ओके.
Thank you, Sapna ma'am. To begin with, good morning to one and all present here. Indeed, it's a great moment to be part of such an initiative, and therefore, I genuinely thank you all for taking out your precious time. Following our traditions and custom, let's begin this session with a small prayer. Thank you.
Charu ma'am, who is sharing? Okay, just a minute. प्रार्थना के साथ में ही किसी कार्य के प्रारंभ होता है और हमने भी प्रार्थना के साथ में माँ सरस्वती की आराधना की। माँ सरस्वती जो ज्ञान की देवी हैं, जो ज्ञान के साथ साथ बुद्धि और विवेक में भी संतुलन देती हैं। आइए इस कार्यक्रम की विधिवत शुरुआत के लिए मैं फिर से चारू जी को आमंत्रित करना चाहूंगी। चारू जी, डॉक्टर मनीष को बुलाने से पहले मैं चाहूंगी कि उनके बारे में आप एक ब्रीफ जी।
Zarur, ma'am. Thank you so much. A divine start is always a worth and auspicious start. Once again, good morning, respected principal sir, teachers, colleagues, and dearest diparians. I wish everyone a very warm and healthy welcome to today's webinar on exploring and understanding the COVID pandemic concern in pulmonary complications. This significant issue is the focal point for any and every person on this earth these days. To enlighten us in the same regard, I take this great opportunity to welcome our guest of honor and the speaker of the day, Dr. Manish Kapadia. A MD by profession, an expert in pulmonary medicine, Dr. Kapadia brings his wealth of national and international experience, which makes today's session more promising and valuable. He named himself many board certifications, and to name a few, He is certified from America Board of Sleep Medicine, recertified from American Board of Internal Medicine, recertified in Pulmonary and Critical Care Medicine. Currently, he is a solo practitioner of mentioned certified subjects of medicines and to perform bronchoscopy and many more procedural skills. He is exclusively associated with some affiliated hospitals as Port Charlotte, Punta Gorda, Englewood, Florida. I, on behalf of my institution, is honored to have you, sir, today with us. I'm certain.
Thank you.
Thank you, sir. I'm certain we all will be amplified with our understanding on concepts, facts, myths, misconceptions in pulmonary medicine by the end of the webinar. Before I hand over the mic to Dr. Kapadia, I need to mention we are really thankful to Dr. Sapna Bansal, who is a facilitator and moderator of this program, for honoring us and choosing our school for this program. Thank you. Now over to you, Dr. Kapadia.
Well, thank you for having me, and good morning to everybody. Thank you to all the organizers. I did the webinar about 2 weeks ago, so that was a good experience for me, and I'm here. I'm excited again to discuss our pulmonary complications, and I'm open for any questions, Sapna madam.
Yes, thank you very much, Dr. Manish Kapadia. Yes, आप में से किसी की भी क्वेश्चन है तो अपने हैंड रेज कर सकते हैं. Dr. Kapadia, we want to know about this particular coronavirus because many, we have more than 150 people with us, and they want to know about this, origin of this corona and what is all about and how this is going to infect lungs. Yes.
So it's almost about 15, 16 months. We heard first time about the coronavirus in US, I believe since late January last year, so it's almost 16 months. कोरोना वायरस कोई नई बीमारी नहीं है. कोरोना वायरस पहले भी हुए थे. कोरोना वायरस डिफरेंट स्ट्रेन आती थी. जो सार्स था, वो भी एक कोरोना वायरस था. उसके पहले मर्स आया था. The mutations होता है उसके जेनेटिक्स में, और म्यूटेशंस की वजह से जो नई बीमारी आती है, उसकी सिवियरिटी होती है. वो ये बड़ी दिक्कत है ये कोरोना वायरस में. अभी जब से हमने पहली बार सुना कोरोना वायरस, उसके बाद उसकी कितनी डिफरेंट स्ट्रेन आ गई है. कल हमने सुना कि there is a new strain in Vietnam which is much more communicable. बहुत ज्यादा स्प्रेड होती है, बहुत जल्दी स्प्रेड होती है. वो कॉम्बिनेशन है यूके एंड इंडिया की, दोनों की. उसकी अभी जेनेटिक एनालिसिस की गई डीएनए की, तो पता चला कि इट्स अ कॉम्बिनेशन ऑफ दिस टू स्ट्रेन्स. सो ये जो बीमारी है, मैं अभी लास्ट वीक ही यहाँ पे हमारे लोकल सेमिनार में था नेशनल स्पीकर्स के साथ. कोरोना वायरस की वजह क्या है कि इतना डेडली है, ये इतना कम्युनिकेबल है. तो जब भी कोई वायरस की रेप्लिकेशन होती है, कोई नई स्ट्रेन आती है, तो द वायरस कैसे ह्यूमन में ट्रांसमिट हुआ, और ये स्ट्रेन कहाँ से आई, कैसे ह्यूमन में आई, वो ही उसकी बड़ी ताकत होती है. पहले हम सोच रहे थे कि ओके ये वायरस बैट्स में थे, बिकॉज पहले सार्स हुआ था 2014 के आसपास के कहीं, तो हमने पता चला था कि ये सार्स वायरस था. Origin was in the beds, people were exploring the caves, and the virus beds में थे, human में आया, तो उसके जो genetic material हुआ that change हुआ. Once it enters into the human cells, then it deposits its genetic material and starts replication. अभी कोरोना वायरस की जांच कर रही है, कोई पुरावा नहीं है, कोई फाइनल डिसीजन नहीं हुआ है. प्रिलिमिनरीज में ये बैट्स और दूसरे एनिमल्स की कॉम्बिनेशन थी. उसका जेनेटिक मटेरियल पहले से ही थोड़ा चेंज हो गया था, बैट्स में से दूसरे एनिमल्स में गए थे, फिर ह्यूमन में आया. तो that's why they think this is much more deadly or much more communicable than the previous SARS virus and stuff. Hopefully someday we'll come to know exactly how this happened, whether it happened in the lab, whether it happened naturally, whether it happened accidentally. Nobody knows. A lot of people are investigating into it. Government agencies are investigating into it. So hopefully we will know someday. But it's with any virus, once enters into the body, the virus has to get into the cells. They have to find a particular receptors to get into the entry into the cells. वो जो receptors, particularly ये जो coronavirus है, what we call COVID-19. Forget about the previous coronavirus infections, but particularly with the COVID-19, it enters into the human cells through these angiotensin receptors, which are located in our nasal passage, airway systems, muscles, the different other organs. These are the prime cells where the virus, their surface antigen attached to the receptors of these cells, and then that's how that gets entry into the cells. Once they get entry into the cells, it releases this RNA and then starts replicating. So why it is so much affecting the lungs, the human lungs, or the respiratory system itself, is because of this abundance of angiotensin receptors in our respiratory tract, including the lung cells, including the nasal airway, pharynx and larynx and trachea. And that's why it's replicates in those local sites very fast and causes more symptoms related to the respiratory system.
Thank you, Dr. Manish. You have very well explained. आप में से किसी के भी प्रश्न है, अपने प्रश्न के लिए अपना हैंड रेज कर सकते हैं. So one by one हम आपके प्रश्न लेंगे. डॉक्टर, एक मेरा क्वेश्चन है जी, एक मेरा क्वेश्चन है कि ये आखिर लंग्स पे ही क्यों इफेक्ट डालता है? I mean, बहुत सारे वायरस आए, लेकिन ये हम देख रहे हैं सबसे ज्यादा लंग्स को इम्पैक्ट कर रहा है. What is the reason behind it?
So most of the virus affect lung. It's not only the COVID-19. पहले भी थे, the SARS थे, the MERS थे, even the regular influenza viruses say they all affect the lung. पर ये जो strain है इसकी, it's very, they replicate very fast. Because of this changing in the strain, their speed of replication has almost like triple, compared to the regular viruses. So, and basically because of the abundance of these angiotensin receptors in our system, once it gets and replicates there and causes the cell damage, तो lungs के अंदर क्या होता है कि अब respiratory cells है और pneumocytes 1 and pneumocytes 2. तो ये जो वायरस एक बार अटैच हो गया एंजियोटेंसिन रिसेप्टर के साथ फिर से जेनेटिक मटेरियल अंदर एंटर हो गया और रेप्लिकेट करना शुरू कर दिया, it starts destroying this basic lung cells called pneumocytes 1 and 2. Uski cell, once the cell is damaged, cell wall is damaged, the permeability, these cells are also, the angiotensin receptors are also in the capillary wall. Once they start damaging that cell wall, it starts leaking all the fluid outside the cell and outside the capillaries. तो क्या होता है कि ये जो छोटे छोटे सेल होते हैं न्यूमोसाइट्स, उसके आसपास जो छोटी छोटी ब्लड वेसल्स है, what we call the smallest blood vessels, we call the capillaries, उसमें से जो फ्लूइड बाहर निकलना शुरू हो जाता है। ये सब होता है न्यूमोनिया में होता है, कोई भी वायरल न्यूमोनिया हो, बैक्टीरियल न्यूमोनिया हो, फिर ARDS में होता है, कोई भी टॉक्सिन की वजह से या इन्फ्लेमेटरी रिस्पॉन्स की वजह से। तो जो फ्लूइड वहां पे आना शुरू हो जाता है, ये फ्लूइड व्हाट वी कॉल इज अ वेरी हाई प्रोटीन रिच फ्लूइड, इट्स वेरी थिक, and then it starts affecting the transfer of oxygen from cells into the blood vessels, into the capillary. तो उसमें ये एक phenomenon है कि वायरस रेप्लिकेट ज्यादा होता है because of the abundance of angiotensin receptors in this particular organs. दूसरा है कि ये जो रेप्लिकेशन ज्यादा होता है तो उसकी वजह से इंफ्लेमेटरी रिस्पॉन्स भी ज्यादा होता है। तो जो बॉडी के नेचुरल रिस्पॉन्स सिस्टम्स है, साइटोकाइन रिलीज होना, एंटीबॉडी रिलीज होना, ये भी ज्यादा होता है। उसकी वजह से ये लंग के अंदर जो सेल्स है उसके बीच में और सेल के अंदर ये एक जात का जो प्रोटीन रिच मटेरियल जमा हो जाता है, उसकी वजह से वो ऑक्सीजन सप्लाई नहीं कर सकता और ऑक्सीजन अंदर जाता है लेकिन वो ब्लड में नहीं जा सकता, तो ऑक्सीजन की कमी हो जाती है। उसकी वजह से दूसरे ऑर्गन्स अफेक्ट हो जाते हैं, जैसे कि हार्ट, जैसे कि किडनी, जैसे कि लीवर, जैसे कि ब्रेन। तो प्रॉब्लम ये है कि
sorry, we have a question from Vanita Garji. Yes, you can ask your question.
Good morning,
yes.
Sir. Good morning. Thank you.
Good morning.
Sir, I just wanted to know that once we have come to know that, okay, the lungs have already got affected, so what next should be the step? And next, what should we do in order to get it rectified or back to the normalcy?
So the biggest
many people
problem
are actually confused these days what to do next, because when we go to doctors and every individual doctor is prescribing something different, so we are really confused what to do next.
The main thing is, once the lung is affected, affected or infected, whatever we call, is because of the viral pneumonia, or what we call is a viral pneumonitis, and all you have to do is a supportive treatment. There is no magic bullet here. There's no particular treatment for the to treat the virus. In any viral infection, the antiviral drugs, some people support, some people don't. It's a very controversial, in my opinion, we don't recommend any antiviral therapy because it really has no role here. It's because of your own body response. Whatever the damage happens is because of release of inflammatory markers in your body, like cytokines and interleukins and different type of, we have so many different type of pathways which causes this, what we call it, the release of inflammatory markers. Uski wajah se ye jo tremendous inflammation ho jata hai lung ke andar, we call pneumonitis, and ye jo X-ray or a CAT scan में describe करता है ground glass opacities. This is basically a medical term for pneumonitis, inflammation of the lung. So what you have, what you can do is, there is nothing. If your body is gonna produce a tremendous inflammatory response. You're going to have more inflammation in your lungs. You're going to have a more severe lung involvement from this particular pathogen. So your body naturally has an ability to fight. Sometimes your body is producing antibody, but it's not enough, and the virus continues to replicate. And there's not much you can do other than providing oxygen as long as you can to maximize the oxygen to the other organs.
Okay,
Sometimes
so
we're
doctor
successful.
is recommending that the oxygen level should be maintained. If you are finding that the oxygen level is going below than 94, then you have to take all the precaution. Am I right, doctor?
Right. The main thing is you have to make sure that your other organs are getting enough oxygen. If your oxygen level is low, your other organs going to get affected. Your heart, your brain, your kidneys, your liver. And once you go into the multi-organ failure, that's what most of the people having a mortality. They're having a hard time fighting with this virus. So the key thing is to maximize and to keep the oxygen level as normal as possible.
Okay, thank you, doctor. Next, we have Manisha Joshi ji. Yes, Manisha ji.
Yes. Good morning, Dr. Manish.
Good morning.
And my question is that what are the long-term lung problems after COVID? And as I myself was infected with COVID, and at that time I had no problem regarding my oxygen level, etc. But now after post-COVID, I am facing this problem of heaviness in the chest at times. And of course, lethargy though is there. But this heaviness in the chest, what should be done for it, and what other precautions should be taken?
So the one thing we know, this COVID pneumonia, what we call COVID-19 pneumonia, is basically tremendous inflammation of the lung. In simple terms, inflammation causes the fibrosis, or what we call a scarring of the lung. The more severe the inflammation you have, the more fibrosis you would have. Now, this inflammation causes damage to your lungs. So initially what you see is a ground glass opacity. Ground glass is, it's a radiological term that is what you're seeing on an X-ray or a CAT scan. But basically that is all this proteinous fluid accumulating inside your lungs, in the cells, in the small alveoli, what we call the air sacs. Longer it stays, it causes more problems. If you have symptoms lasted only for, let's say, 6 days, most of the time, and it starts resolving, most of the time this fluid will dissipate and you're not going to have any long-term damage. So when you're looking at the X-ray, you can predict how long you would have symptoms. If you just have a ground glass opacities on your X-ray or a CAT scan, and it goes away, you may have a really bad involvement, but within 5 days it cleared up. Most likely, you're not going to have any permanent damage or long-term symptoms. Temporarily, you get short of breath and things because it takes several weeks to symptoms to recover. But long-term, you're not going to lose lung function or lung capacity. Now, same thing, किसी को बहुत severe COVID-19 pneumonia हो गया, उसको ground glass opacity में से fibrosis, what we call a scarring. When you see the scarring, you start seeing these, honeycomb changes, like you have a lung cell, and this is all radiographic. So you can do a CAT scan and you see that you have a lot of scarring in the CAT scan. Eventually that becomes a permanent. Means once you have those permanent thing, it does not resolve, means you're gonna lose lung capacity. If your lung capacity, let's say, started with 100% and you started developing the scarring and you do the breathing test now and your lung capacity is 50%, so you already lost 50% lung capacity. That prognostically will tell you that you're gonna have a long-term symptoms of, because your lung is not normal, it's never gonna be normal again. And that tells you that, you will have shortness of breath, you may have a cough, and you may have a problem transferring oxygen. Your oxygen level might be 95, 96 when you're resting, no problem. But as soon as you do something, it goes down to 84, 85. And those, it's very hard to get it back. So the prognostically, you can do a follow-up X-ray or a CAT scan to see whether you really have these fibrotic changes. If you don't have a fibrotic changes, this is all because of just the weakness you get from this infection, causing your shortness of breath temporarily. As you become more active, you rebuild yourself, you come out of this deconditioning, and your shortness of breath will go away. Remember, if you have a flu for 2 days or 3 days, you get weak and you feel short of breath. If you have a diarrhea for 5 days, you're losing all the electrolytes, you get weak and you start doing something, you're going to feel short of breath. This is a natural thing. But as your body recovers, slowly you build up your strength and stamina, and you're not having that shortness of breath as much. So the big thing is, you do a follow-up CAT scan and you see whether you really have any residual scarring. Is your CAT scan has almost normalized. You don't have more like a honeycombing or big fibrotic changes. If you don't have that, that means your symptoms are temporary. As you be more active, exercise regularly, then probably most likely, you're going to overcome with your shortness of breath.
Thank you, sir.
Thank you. Yeah, next we have Priya Gambhir. Yes, Priya ji.
Good morning, everyone. Am I audible?
Yes.
Yes, good morning.
Doctor, I would like to ask how far CRP and ESR level post-COVID recovery is related to lungs. If it's still high after being, coming negative, is it still related to lungs, or we are having some other problem?
So CRP and ESR, these are very basic tests. We had it for many years. I think, people started paying more attention because of the COVID-19. But if you have inflammation anywhere in your body, doesn't have to be COVID related or anything. If you had arthritis, your ESR or CRP level would be high. If you have gallbladder infection, CRP, these are very, very, very non-specific labs. It's like, the white count in your blood cells. You do the regular, the hemogram, and you have a white count. If you have inflammation or infection, your white count will go up temporarily, and it's high. It tells you whether you have infection or inflammation. Same thing, these are very, very non-specific labs. The reason we pay attention very closely in a COVID-19, because a lot of people were very healthy, they had no problems, and their labs were normal. And now they're getting this. This is a good prognostic factor shown in multiple studies now, retrospectively looking that people whose CRP level was very high and remained high, they had a bad outcome. But the people whose CRP was high, it started coming down and is big normalized. Same thing with the D dimer was high, started coming down and then normalized. They had a good prognosis, means their chances of full recovery was very, very, very good. So CRP remains high, but you have no symptoms and you're feeling good, you have no problem with the oxygen. That means it may be something else is causing your CRP to be high. Doesn't mean, you may have some osteoarthritis or some sort of a rheumatologic disease or some other kind of inflammation somewhere in the body, or you may have some other kind of infection going on causing your CRP high. But particularly related to COVID-19, I think it's more of a prognostic for first 2 weeks. I don't emphasize much on a CRP after first initial 14 days. But if your CRP is high and by day 6 or day 7 it starts going down, I predict that this patient is going to fully recover and probably not going to have complications. If I have seen people whose CRP stayed very high at day 11, day 12, I start worrying about them. And even though they they're feeling good, I say, okay, you know what, we need to monitor more closely because this is something started. You had no problem before. You never had a high CRP. This is just started with COVID-19 and it's staying high. That means there is a viral replication still going on and causing some inflammation somewhere in your body. But if your symptom has normalized and the oxygen level is normalized and your CRP is high, it's just very non-specific. I don't emphasize much on that.
Okay. Thank you Priya ji. Next we have Smita Maurya ji. जी स्मिता जी आप अपना क्वेश्चन पूछिए.
Good morning, Dr. Sir. Am I audible?
Good.
Okay.
Yeah.
Okay. Sir, I have two basic questions. First one is that are the people with the lung disease, like maybe bronchitis or asthma, more prone to COVID? And if it is so, then is there any additional measures for those people to take the precautions so that to safeguard themselves against COVID?
Sure. So let's address one by one. The first question is people with a chronic lung disease. You know, chronic lung disease means anybody who has asthma, who has emphysema or COPD, has a pulmonary fibrosis, pulmonary, hypertension. Are they more prone to COVID-19? They are not more prone than anybody else as long as they're taking precautions. But if they get infection, their ability to fight, it's not going to be as same as somebody who never had any problems. So people, your lung is already compromised because you have bad asthma, or if you have let's say COPD, emphysema, and you get a COVID-19, you already had some lung damage to begin with, and now with the COVID-19, if you get additional lung damage, you're going to be much more severe. There is a possibility that you may need oxygen, much higher oxygen than other people. You may need to be on a ventilator than other people. And, these people who has a chronic lung disease, their immune system is also kind of compromised because they are on some sort of chronic therapy, like steroids, chronically taking inhaled steroids, or the prednisone therapy frequently because of their asthma flare-ups. They need this steroid therapy frequently or something like that. So their immune system, their immunity is not as stronger, right? So just having a lung disease does not make you more prone to develop it, but your response is not going to be, your recovery response is not going to be as normal as other people. So that's one thing. The other thing is what precautions you take. And, the best thing is, vaccination. We emphasize, and that was our strategy here. The first thing is people who has a chronic disease, including anybody who had a chronic lung problems, who had a diabetes, who had a high blood pressure. After all the people who work in the hospital and people who were in the nursing home, they were vaccinated first. And those are the people who we encourage them to get vaccination. So the priority was to vaccinate all the people who work in the healthcare industry first, and the elderly people who were more than 65 years old but stayed in a nursing home, vaccinate first those, because they have a very limited ability to fight and produce antibodies. Once they were done, majority of them, then the next group was the people who has a chronic problems like chronic lung disease, because they are compromised, or anybody who has a chronic other disease, like their immune system is going to be low. They were the second most priority group. So as long, the thing is, if you have a problem, your best thing is vaccinate and protect and start building the antibodies. If you can't do it, you take double precautions. You don't expose yourself, you wash your hands frequently, you sanitize every single surface you touch, you double mask when you go, you follow this 6 feet, the distance rules. And, and if you can do it, you can protect yourself very well, and then, get your vaccine and, as soon as possible.
Okay. Thank you, sir. Thank you, sir.
I hope you got the answer.
Yes, ma'am.
Okay. Thank you. Yes, next we have Rekha Gulati ji. जी रेखा जी आप अपना क्वेश्चन पूछिए.
Good morning, sir. And
Good morning.
Sapna. Good morning, Sapna ma'am. First of all, as I want to ask, antibody test is compulsory after COVID?
It's not compulsory at all, and we don't recommend to anybody to have that, because you have to measure the very particular antibody, to see the response to your. Are you talking about the after the COVID vaccine?
Yes, after the COVID.
Okay. So, it's not available to a lot of places. I mean, you have to do it. General antibody test is not going to help you, and timing of doing the antibody test is very important. So, usually it takes about, usually, once you have that fully vaccinated, once you have 2 doses of vaccine, the definition of fully vaccination is 2 weeks after the second dose of the vaccine. So that's when you consider the fully vaccinated. And that's where you start generating the antibodies.
As my son has gone through this COVID, he is 25 years, not yet vaccinated. So antibody test is compulsory?
It's not compulsory at all. And it doesn't have any prognostic future or anything. It doesn't tell you whether, how is it going to do in the future. Some people make antibodies in 2-3 weeks. Some people take a little longer response. It depends how your body is going to, respond to the vaccine. Generally, we don't encourage anybody to do that. Once you're fully vaccinated, that's the best hope. But it's not compulsory, mandatory at all. It doesn't really tell you anything more.
Okay, thank you. One more question. As we are not knowing this coronavirus will continue till how many years. So what precaution does somebody says we should not eat sour foods that harm our throat? जैसे कि, so what should we should avoid these sour food?
There's no science behind, as far as I know. There's no studies done about it, and I don't think there is any correlation. This is all depending on the strain and depending on how your natural immunity is.
Okay.
If you have a good immune response, if your body is going to generate a good immune response and enough antibodies, you're going to fight. This is nothing different than the virus. Unfortunately, the only different thing here is, and this is not the first time we had a coronavirus. We all probably had a coronavirus infections in the past. There's nothing abnormal about it. Coronavirus has been there for many years.
Okay.
So this particular virus, because it's a combination, it went from the batch to the other. Now we know, at least we scientifically, there's enough information that we know that went from the batch to the other animal and then mutated and came to the humans. It didn't come directly from the batch to the human. So it's a zoonotic virus. That's what they call zoonotic virus, but it's a kind of complicated zoonotic virus,
Okay.
and that's why it's more difficult to fight. But it all depends how your body is going to respond, how your body is going to produce the antibody, and that's how you're going to overcome. People in different part of the world has a different strain, because the virus continues to mutate, and every time it mutates, there is a change. So your body, even though you had exposure to previous one, you may not have a very specific antibodies to fight this new strain, and you may get into trouble. That's why nobody knows. I mean, your question is great, but nobody knows how long it's going to stay around. People are very, very hopeful in the US, but Dr. Fauci put a statement today on a Memorial Day here that this is far from overcome. Do not, underestimate, because as long as the virus is going in other countries, and we just learned yesterday about this new Vietnamese strain, which is a combination of the UK and Indian, strain. So, who knows how long it's going to continue to replicate and keep circulating. Your best thing is don't take it lightly.
Yes.
Take the precaution.
Yeah, thank you, doctor. Very well you have explained. Next, we have Priya Gambhir. Yes, Priya, please unmute yourself.
Sapna ma'am, Priya has already put up the question. I think the next person.
Okay. Maybe the lower hand. Okay, Sanjeev Sharma. Mr. Sanjeev Sharma.
Doctor, good morning, Doctor sir.
Good morning.
Sir, it has been seen in a lot of cases, a person recovering at the initial stage becomes fatal and dies within hours and within days. So what is that?
So, we were talking earlier, and I have seen myself, so many patients recovering in the beginning when we didn't understand what was going on. But so our body has a natural response to any kind of foreign antigen entering our body. There's a various different type of, immune response. There's cell-mediated immunity and a humoral immunity, the antibody formation, plus all the release of certain, inflammatory markers, the interleukins, cytokines, all these things. And everybody's response is different to that. What happens is when you have this tremendous inflammatory response, we know the pathophysiology behind this virus. Those are like what we call a pro-inflammatory markers. They are pro-coagulant too. So it causes these small, blood clots here and there, and this happens with a lot of other kind of infections too, not particularly with the coronavirus. But I think the sudden death is happening is because this virus, if they have so much inflammatory response and producing this procoagulant state, even though people are on a blood thinner medications, they developing sudden clots, either in the heart, either in the myocardium, or either in the lung, either in the small other blood vessels, and suddenly collapsing the circulatory system, causing this sudden death. That's one theory, and that's most widely supported so far. That's one theory. Nobody, there are some other theories there too, but nobody knows 100% exactly what's happening to these people. But majority of the people in the medical field, agrees that this is because of this sudden clotting things happening here and there, causing this sudden death.
Yes, heart attack also taking place after, COVID recovered. Yes, next question from Anu. Yes, Anu. Unmute yourself, Anu. Yes.
Hello.
Hello.
Can you hear me?
Yeah. Mm-hmm.
Actually, this regarding my wife, Anupma Jain.
Okay.
Yeah, she had COVID and she's in like recovery mode, and already a month before she had, but still fever is continuing. That is in morning it 98, but in evening it goes as high as 99.5, but never at the moment cross 100. Can you advise?
So, yeah, there might be something else going on. It may not be related to COVID at all. I think I would recommend that check with the doctors. They have to do the basic test for the common reasons to have a fever. Make sure there is no urinary infection, there is no inflammation in your belly anywhere around the gallbladder or pancreas or some problem with the kidneys. She may have a regular bronchitis or pneumonia or sinus infection or something. A lot of people have a chronic sinus problem after the COVID-19, and they have, like, all of a sudden now their sinuses are filled with the fluid and having this low-grade fever. Sometimes if she has a blood clots in her legs or in a small blood vessels in the arm or lung, will cause fever for a long time too. So there's a various reasons to have a fever for a long time, but I think the doctor has to know that they need to do a thorough workup to find out where is this fever coming from. It's very unusual to have fever after COVID-19 for a month.
Okay.
That it might be something else going on there.
Yeah, testing has been done, and blood testing, having like this Vidal and malaria. Okay, and nothing is what came out, and blood reports are normal, and ultrasound was done, like belly and lower portion, and it was clear. And also like CT scan of chest was done, and pulmonary, that is was no problem. There was no CT score came. They told it is clear, and
Okay.
yeah, and what doctor say here? I consulted two doctors. First doctor gave her 5-day course and antibiotic. Again, some started, but after 5 days, still the situation remained the same. She reported, I have a pain in the neck. So we went to ENT. Now ENT course also finished. Okay, but and test reports, all ENT asked us to get it done. All was done, like ultrasound, CT scan, and blood report. Like I think 8th time we have got done from COVID start, and her CRP, her TLC, or this red RB or hemoglobin or infection, like is all like ESR, like something.
ESR.
So these all parameters are guess in the range. Doctor say you don't have a issue, just wait and watch. It will go by itself.
So what she has is what we call a fever of unknown origin, FUO.
Right.
And a lot of time, I mean, those are the people that you have to do extensive workup, rule out one by one thing. She may have a little bit inflammation of the heart muscle, or it could be some sort of infection in her blood. You have to do the whole long process. It's a very frustrating thing, but sometimes it takes time to find out exactly where the fever is coming. Sometimes fever could be because the medication she's taking. People can have a fever by taking certain antibiotics too. So we when we see these kind of patients, when we can't really figure out where the fever is coming from, we recommend generally to stop on all unnecessary medications. You have to make sure there is no blood clots. You make sure there's no sinus infection. You make sure there's no infection in the blood, like a not bacterial but a fungal infection or anything. All the thorough urinary infection, the kidney infections, gallbladders, pancreas. There's no inflammation around the pancreas. You have to do the echocardiogram, make sure there's no vegetation around the heart valve. And I mean, you just have to do one by one to rule out everything. But basically what she has right now is a fever of unknown origin. I'm not really familiar with any patient that had a fever for 1 month from COVID-19. So especially if she does not have any, inflammation going in her lungs, I doubt this is because of the COVID-19. There's something else. Maybe, make sure the medication she's taking is not causing the fever itself, or there are the things that needs to be checked. It's not checked properly. Maybe she needs a CT scan of the sinuses. Maybe she needs an echocardiogram to make sure there's no vegetation around her heart valve. Maybe Maybe she has some inflammation around her pancreas, or maybe there is something in the blood that they're not able to, culture it yet. Maybe, she needs this. So she's gonna need a more aggressive workup for those
Yeah,
things.
even urinary, that urine also testing done. Culture came clear, and the blood culture, that 5-day report, that is yet to come. So be waiting for that. If something found in that, at least we are sure our problem is found. Then treatment will come
Right.
later. And there's one
Yeah,
more
but
update. Actually, she had we had COVID vaccine on April 2, first dose. Okay,
okay.
and then she caught fever. Like the day she took vaccine, the other day she caught fever, and that fever went by itself in 2-3 days. So we thought everything is normal. And on 17th or 18th, this symptom started, and on 23rd we started all medicines COVID, because when blood report came, it showed all parameters, high, like CRP, like infections, etc. Everything was high. So my question is, I'm little bit fearful to take Covishield vaccine to first dose. When to go for second dose, and will it have any side effect?
That's very, that's a very difficult question. And, if she had, so most people will have some, fever, chills, muscle aches, headache, after the vaccine, especially the people who had a COVID infection before, they usually have those symptoms with the first. And in my observation, the people, when they took the vaccine, the second dose, they had a little more severe symptoms for a few days, because it's all, your body is trying to produce antibodies, and that causing these symptoms. So if you never had a COVID infection and you take the first dose, usually you have a very minimal symptoms, and sometimes no symptoms at all. But most people will have some with the second dose if you never had a COVID. But if you already had a COVID infection and you take the first dose, you already had some antibody in your body, because you had an infection before. Your body has generated some antibodies, and now you take a vaccine and try to generate more. With the very first dose, you will be symptomatic. You will have fever and chills, which is, in a way, it's a good response, because your body is generating antibodies. Okay.
Okay, next question. Yes, many people have a question here. Redmi 8, yes, you can ask your question. सर, आपसे रिक्वेस्ट है, आप अपने प्रेस्क्रिप्शन हमें भेज दीजिएगा. बाकी के आपके क्वेश्चन का यदि कोई और डाउट रह गया है तो हम आपको डॉक्टर से कनेक्ट कर देंगे. जी, Redmi 8, yes. Unmute yourself. Okay. Divyanshu Thakur, yes. Unmute yourself.
Yes, ma'am. Yes, ma'am. My question is that why does it have, when anyone take COVID vaccine, why it happens that it suffers from fever?
Okay.
So what I understand is, like, why people get fever with the COVID vaccine. Is that what you're asking?
Yes, the same thing he is asking.
Yeah. So that's basically your body is trying to, in response to the vaccine, your body is trying to make antibody, and that's basically, it's a natural thing. So every time you're going to produce antibodies, you're going to have those symptoms. So, in a way, it's a good thing.
Okay. Vijwal Kumar. Mr. Vijwal Kumar. Yes.
Yeah, hi.
Hi.
Sorry, the meeting is named after my child name, but my name is Vinod Kumar.
Okay.
So actually, I just wanted to ask this question because I had typhoid diagnosed on 10th of May. So till 29th of May, my medication was going on, like 20 days it took. And afterwards, I just wanted to know that after how many days I can take COVID vaccine. And the second question is, is there any typhoid vaccine as well available?
But okay, going to your COVID response. as long as your typhoid is completely treated and you don't have any symptoms of typhoid, I think you can go for the COVID vaccine. As far as the typhoid vaccine goes and the timing in a correlation with the COVID vaccine, I think you're going to have to consult your local immunologist. There are typhoid vaccines available. I'm not very familiar with the typhoid vaccine, so we don't generally use that commonly here at all. But to your first question, if you're not symptomatic with typhoid, if it's completely treated, there is no contraindication to have a COVID-19 vaccine.
Okay. Next, we have Vandana Taneja ji. Vandana ji?
Hello. Hello.
Yes, you are very well audible.
Good morning, doctor.
Good morning.
Doctor, I just want to ask if somebody is having high platelet counts in the blood repeatedly. So, I mean, the person should go for COVID vaccine or not, because we are hearing a lot about the clot factors associated with this coronavirus and COVID vaccines. So I just want to ask if a person is having high platelet count in repeated blood tests, so the person should go for the vaccination or not?
There is no contraindication for the COVID vaccine. There are some, reports which is, in some cases in 1 million patients. So it's very, very rare. They had some sort of, not particularly the blood clots. Some of them had a bleeding complication. Some had a blood clots with the vaccine, particularly, talking about the AstraZeneca and Johnson & Johnson vaccines. But just having a simply high platelet count is not a contraindicator for COVID vaccines. You just have to monitor the level, make sure it doesn't go up, or I would recommend that at least for a few weeks you keep monitoring your platelet count. If your level going up, you might want to talk to your consultants and add something like simple aspirin or Plavix or those kind of medications to make sure you don't get complications from it. But high platelet count is not in general a contraindication for COVID vaccine.
Thank you so much. Thank you.
Okay, next we have Sunil. Sunil ji, please unmute yourself.
Namaste, madam. Namaste, sir.
Namaste.
Recently, my father was affected with COVID. He got discharged 10 days ago. He is 76 years and he is non-diabetic, but he is having BP hypertension. He is experiencing shortness of breath. He cannot even walk for 5-6 meters. So to improve the lung capacity, can he do some breathing exercises or spirometry? Is it advisable at this stage, or we have to wait?
Did he have a lung involvement with his COVID-19, or he just had a positive test?
No, he had a CT score of 16/25.
उसका ऑक्सीजन लेवल कैसा है?
अभी ऑक्सीजन लेवल 97-98 sir.
Okay. He can do any exercise, any physical exercise. That's the only way he is going to come out of the shortness of breath. Longer he stays in a bed, it's going to be longer for him to recover. He's going to keep losing his strength and stamina. With any disease, once you're recovering, you need to start doing more and more. You have to push yourself. As long as his oxygen level remains good, if his oxygen stays more than 94, he can keep doing exercise. If his oxygen with exercise, if his oxygen starts going down, I would recommend he puts the oxygen on and keep exercising and keep his oxygen level normal. But that's the only way he's going to come out of the shortness of breath.
Okay. Whether steaming also improves lung capacity, sir? Steam inhaling?
Not necessarily. No, steam inhaling will not. He needs to rebuild his strength and stamina. He probably got, the muscle weakness. Your breathing depends on the muscles involving the chest wall, your diaphragm strength, your overall strength, and you're gonna have to rebuild that strength and stamina. Incentive spirometry is a one way he can use incentive spirometer, suck into it, and then expand his lungs more. But he needs to start doing some more physical activities, and it's not going to be easy for him, but he's just going to have to push and make sure his oxygen stays good. If his oxygen stops going down with exercise, he needs to put the oxygen on and keep the oxygen level normal while he's exercising. But that's how he's going to overcome this. A lot of yoga things helps, I heard, and you can sign up for some online yoga classes for him. He can do, will help naturally to improve his lung capacities and stuff like that too.
Okay, sir. If in ideal condition is having 97, 98, but when exercising, we do not have the reading. We have to see how low it goes.
Right. That's what yeah. So keep it on and just tell him that, okay, exercise and keep checking it and see how low it goes. If it goes low, put the oxygen on. But he needs to do more exercise and rebuild himself.
Okay. Next, we have a question from Archana L. Bali. Ji.
Good morning, doctor.
Good morning.
You have probably answered my query. It was like we are living in Delhi and the NCR region, which is already so much polluted. So the persons who have already recovered from or are in the recovering phase, so what do you recommend other than medications? What are the other things? I believe you've already answered that we should go in for yoga and physical exercise. Is there anything else that we can do in such situation?
No, recovering, if you're having symptoms, your body is going to recover with this over time, but maintain your exercise program, keep doing routine things. You may have a little bit hard time in the beginning, but that's how you're going to rebuild your strength and stamina. So yoga is one thing. Certain particular type of yoga will help to rebuild your lung capacities and stuff like that. Any physical exertion, any physical activity is good for your lungs. So if you like swimming, that's one thing. But you can do treadmill, you can do simple walking as much as you can tolerate, but any activity is good.
Is meditation going to help in this? I mean, other modalities, if we go into other modalities, is it going to help us in any way? I mean, because we have seen, I have seen personally in some cases, the patients are having a memory loss for some time, or they are going through a lot of emotional imbalance, depression and all. So are these modalities, really working?
Well, definitely. I mean, meditation is it's all about controlling your mind and your thought process and improving your brain power and stuff. So it definitely, if they're having a lot of the psychological issues, definitely I think it was one way to keep your brain process and thoughts clear. But I emphasize on routine activities and exercise a lot to improve your strength and stamina and your lung function. But for mind and power, you can do meditation. There is no harm. It's all benefits. Long term, it's all benefits.
For the peace
from
of
meditation.
mind, I think it's very good because this time is stress, anxiety and lot of depression. So that will help definitely. Okay. Next we have a question from Varna. Yes.
Hello.
Yes.
Hello.
सर आई वांट टू आस्क हमें कैसे पता चलता है कि हाँ कोरोना हो गया है किसी को?
Well, I'm sorry, what was the question?
She is asking कि हमें कैसे पता चले कि हमें कोरोना हो गया है?
वो तो symptoms, आपको बुखार होगा, आपको खांसी होगी, आपको स्मेल, टेस्ट, जीआई सिम्टम्स है, कोई डायरिया वैसा हो जाता है, वीकनेस आ जाती है, तो फिर जांच करवाएंगे तो पता चलेगा कोरोना हुआ है कि नहीं। पर कोई आपकी नजदीक में कोई है, उसको कोरोना है और आपको पता है कि आपको एक्सपोजर हुआ है, तो फिर जल्दी जांच करवानी, इट्स वेरी इंपॉर्टेंट। बाकी तो सिम्टम्स के ऊपर।
Yes. Next we have Vandana Taneja जी। जी वंदना जी, अपना क्वेश्चन पूछिए।
Sapna ma'am, Vandana ma'am has already asked the question.
ओके, वो हैंड रेज है। किसी और का कोई क्वेश्चन हो तो अपना हैंड रेज कर सकते हैं। एनी अदर? ओके, रंजन लाल जी, जी अपना क्वेश्चन पूछिए रंजन जी। अनम्यूट करिए आप। आप अनम्यूट नहीं कर पा रहे हैं रंजन जी।
हाँ मैडम, मेरा क्वेश्चन, डॉक्टर साहब गुड मॉर्निंग एंड सपना मैडम गुड मॉर्निंग। सर माय बेसिक क्वेश्चन इज माय ऑक्सीजन लेवल इज ओनली 92 to 94.
Oxygen level
90 to 94, but I am bargaining easily way, no problem. I want to know only कि if I want to increase my oxygen level, so I should do steaming or respiratory.
नहीं, कोई भी एक्सरसाइज करो, रेस्पिरेटरी एक्सरसाइज करो, इंसेंटिव स्पिरोमीटर। स्टीमिंग से आई डोंट नो that will improve your oxygen level. You should do steaming only if you're symptomatic, if you have some problem, congestion जैसा कुछ है, और रिलीव करने के लिए temporary. I don't recommend regular steaming thing, which it may cause more harm to you long term. But any exercise करो, or pulmonary exercise, incentive spirometry करो, वो जो छोटा सा मशीन आता है ना, वो प्लास्टिक का होता है, क्या है कि उसमें से, हाँ वो
बॉल सर,
या उसको बोलते हैं incentive spirometer. Just वो keep practicing that, but any physical exertion will automatically strengthen and make your oxygen level better.
Sir, so, how many times I should start in a 24 hours?
As many time as you can. There is no restriction.
Any other suggestion to increase? Sir, any other suggestion to increase oxygen level? I am bargaining easily way. I have no any problem. I was COVID affected on 24th April, and after 16 days, I was on oxygen. On 17th, I relieved from Ascent Medical College, Agra. Now I am feeling well.
Yeah, you do any exercise will help your oxygen level. It may take a little more time, but just keep exercising. Any physical exertion, you don't have any symptoms, so you should be doing more and more exercise. Eventually will make your oxygen level better.
I think deep breathing will help you. Deep breathing will help you. If you will take deep breathing, that will help you a lot. And secondly, one more thing is that if you will be associated with plant and nearby, oxygen level, that will be good for you. And one more thing, कि be positive. Oxygen level अभी आपका बहुत कम नहीं है, इसलिए आपको चिंता करने की जरूरत नहीं है। और ये स्ट्रेस मत लीजिए, कभी कभी हम स्ट्रेस ले लेते हैं, उससे भी हमारा लेवल काफी नीचे आ जाता है।
Okay, thank you, sir. Thank you, sir. Thank you, madam. Thank you, madam.
Yeah, next we have question विजय कुमार जी। जी पूछिए आप अपना क्वेश्चन। विजय जी, ओके।
गुड मॉर्निंग डॉक्टर।
गुड मॉर्निंग।
हाँ सर, मैं ये
आपकी वॉइस बहुत कम आ रही है विजय जी।
हाँ मैडम, अब आ रही है?
हाँ जी, हाँ जी।
हाँ मैडम, मुझे जो न्यू कोरोना वायरस का न्यू सिस्टम आया है, उसके बारे में कुछ इंफॉर्मेशन चाहिए कि मतलब वो कहाँ इफेक्ट कर रहा है।
ओके, शायद आपकी वॉइस हम तक नहीं आ पा रही है। नेक्स्ट क्वेश्चन मैं चारू कालरा से ले लेती हूँ। अनम्यूट योरसेल्फ, चारू।
Okay, am I audible now?
Yeah, very well.
Okay, I have two questions. One is I would like to know that what are the precautionary measures one can adopt, especially for children, regarding these, to guard the lungs, because as pronounced, we are expecting the next strain is going to impact children. And as I'm coming from a teaching profession, so I would also like to know for my own children and for the school, what all precautions, we should go on for. This is my first question. And my second question is, since the doctor is from the health industry and specialized in the pulmonary medicines, can we expect the medicine for small children to get vaccinated? So this is what I want to know out of curiosity. Thank you so much.
Thank you. So precautions is universal. As long as you follow the simple rules, hand sanitization, mask, 6 feet distance. I mean, this is must thing. When people make mistakes is, they have exposure, they have symptoms, they're taking it lightly, they're not letting anybody else know, and they're passing it to somebody. And the key thing is early isolation, early tracing. It's very, very important. All these countries, you look at the examples, they did a great. The countries like Taiwan, who had a very, very few cases, countries like Australia, New Zealand, certain European countries who had a very, very few cases, is because as soon as they found one case, they contacted all the people who came in contact with them, they isolated them, they tested them, they make sure they don't have it and they don't pass it. But for your personal protection and your kids' protection, basic rule is same for adults, for children. You sanitize, you wear the mask, you wipe out all the surfaces what you're going to touch. You maintain the 6 feet distance. You travel outside the house, make sure you take all the precautions. As soon as you touch something, make sure you sanitize your hands and stuff. It's then, of course, you don't know somebody else has it, but you do your best, because people are not always honest, telling that, hey, I was positive, go get yourself tested, or sometimes you can't find out and you came in contact with. So you take the precautions, you maintain the 6 feet distance. And if it's not absolutely necessary, then don't go out. That's the best protection you can have for you and your children. If you have to go out, you make sure you take it. When it started, I'll tell my my parents live with me. They elderly. My kids were living with me, working in the ICU, and I was working 18 hours, spending 18 hours at that time. I'm talking about March, April, May, June, July last year. And I come home, my clothes goes into the wash, I take shower in the outside bathroom, the poolside bathroom we had. Nothing comes from my car into my house. All my keys, all my wallet, everything stays in the car. Nobody's touching it. And luckily, nobody in my family had it. So you have to think of themselves, and if you're going out and you exposing yourself, you make sure that you sanitize yourself very good, so you cannot pass to your kids. Now your second question was about the new strains coming out, and or the vaccine for the kids. I think they're working on it. I mean, we don't know. They approved the 12 and older with the Pfizer vaccine. So they're working on to get age 5 and above. So hopefully we'll have them. And but we just have to wait and watch when that's going to be available. But at least for now onwards, we have a 12 and older are approved for the vaccine. So we're waiting for the next phase. I think the Moderna is working on to get approved for age 5 and above. So we'll see what happens.
Okay, I think she got the answer. Yes, actually, till the time, no exactly database as well, and we are working upon it. Lot of research every day taking place. So yes, it will take some time, but yes, vaccination very safe. You have to go ahead with the vaccination. Next, we have a question from Smita ji. Unmute yourself.
Good morning, doctor. Once again, I had a very basic question. Very basic question, sir. I had COVID, so am I going to get the immunity? I mean, is it going to act as a vaccination? Do I need to take the vaccine now after COVID, or I can just skip it?
Well, current consensus is even if you had a COVID, you should get full vaccination. Don't skip a dose at all. Because nobody knows that if you have a vaccine, if you have an antibody from COVID, how long it's going to last. And that's why, they recommended full vaccination without interruption or change in the schedule in a people who had a COVID-19. If you, even the, at least the CDC consensus here is if you had a first dose of COVID-19 vaccine and then you get infection, and so you wait for 14 days and if you are asymptomatic by then, at the end of the month, you go ahead and do your second dose on a schedule rather than interrupting the schedule. That's a CDC recommendation here. So unless you are symptomatic, if it's 10 days from your last symptoms or last positive COVID, go ahead and fully vaccinate. So, consensus is regardless your COVID status, you should fully vaccinate yourself.
Yeah, Dr. Manish, I want to add one more thing. You can take 6-week gap because after COVID positive, yes, you need to take 6-week gap because as America having different strain and India having different. So I mean, all the doctor past 27 days, they are recommending you have to take at least 6-week gap. That would be good for you.
Thank you so much. Thank you, ma'am. Thank you, sir.
Yeah, welcome. It was a really great session. Thank you, Dr. Manish. So, I mean,
thank you.
Yes. Without any late, I would like to, call the principal on the, this platform webinar, and we are very happy to be, he's associated with us, Dr. Pramod Kumar. He's associated with this school, he's a founder principal actually from the 1988. He's working with the same school, and I would like to call upon. Yes, sir. You're most welcome.
Good morning, everyone. Ma'am, with your kind permission, I have got just 2 basic queries. If you permit me, then I also want to ask.
Sure, sir. We'll be very happy.
Only.
Sure.
Doctor?
Yes, sir.
First one is, what is the status of the COVID in US? And second one is, in India, we are hearing a lot about third wave. Is it just based on speculations or based on some studies? Just these 2 basic questions. Queries rather, not questions.
Right. Status, as far as the US goes, actually, they pretty much opened up everything. The CDC came out and says that, you don't need, if you're fully vaccinated, you don't need to have the mask. They just had a first NASCAR event in Indiana yesterday, and the full stadium, 100,000 people was full completely. Such a big event happened in the US. But cautiously, everybody's aware of what's going on around the world. As far as the strain what we have, our vaccine is very effective. That's what we at least thinking at this moment. But nobody knows what's going to happen with the next strain and how effective it is. And that's why everybody needs to be very vigilant and cautious. But I'm not sure about this third wave. theory, so the certainly depends on the mutation of the virus and the strain, and whether it's effective. The vaccine you have is going to be effective against that particular strain or not. So the emphasis here was to vaccinate people as fast as possible, because we know that once you vaccinated, you're going to have antibody. We, at least early studies showed that it's lasting for three months or so. So we're trying to vaccinate everybody, as many people possible. We still have 40 million people in the country who do not want a vaccine. So that's always a concern, because they can get a regular whatever the strain we have here, and they can pass it to some other people and everything. But as long as your vaccine is effective and that for that particular strain, I don't think it can have a third wave. Our numbers are tremendously down. I mean, we have, in just last 1 week, our infection rate is 50% down compared to a week ago. So it's rapidly coming down, and and pretty much everything is opened up now. I mean, there are few people wearing masks here in the public now. You go to the supermarket or even sports events or clubs or anywhere, and because most of the people are vaccinated. So for key, I think the key for the India is to mass vaccinate as fast as possible. And if you can do that, you can prevent the third wave. Because that was the emphasis here, that you vaccinate as soon as possible the people, get as many hands as possible, and that was the most effective way. They cut down these numbers very fast, effectively, and now they're not transmitting. So, governments, the societies has to do whatever possible to enroll as many people and get as many vaccine and mass vaccination. Then there won't be third wave. That's what I believe.
So I understand you are saying that less percentage of the people have been vaccinated in India, so that is why they are talking.
Well, that I think because vaccination is the key to cut down the infection rate. The treatment what we have, it's going to help to recover from the infection. But if you want to prevent the transmission, if you want to prevent the more and more people getting infected, you're going to have to vaccinate. That's the only way to prevent the transmission. People there are people who follows in certain preventive measures, maintaining the distance and wearing the mask in a public or sanitizing themselves. It's very difficult to enforce in a country like India, where the population is so huge. So only way you can knock down this transmission is mass vaccination, and allow the people to go in the public if you are fully vaccinated. If you're not vaccinated, you stay home. And that's the only way you're going to be able to control this, I think.
Anyway, thank you very much, sir. So let me present formally my thanks. So on behalf of the school management committee, staff members, children, and parents, and on my personal behalf, I thank you very much, sir. It was really very nice, and we were very privileged to be with you. And we are thankful to you that you have found time for us, and you have presented your point of view, you have interacted and answered all the possible questions whosoever is put up to you. I am really, once more, I really thank you from the bottom of my heart. And I am thankful to Dr. Sapna Bansal. She is very, very smart and active lady. It was she only who contacted me, rather, in place of me contacting her. It was she who contacted me. She asked me Yes, sir, we want to have this program. Although I am very, enthusiastic person. As soon as she asked me, I responded positively immediately. Madam, I'll be thankful. You tell me what I have to do, and then we'll be very happy to be with Dr. Manish Kapadia. So whatever I thought, whatever I visualized, I have got more than that. So once more, on behalf of everybody, I thank both of you from the bottom of my heart. Thank you very much. May God bless all of you.
Well, thank you, and it's my privilege. Actually, you got a really nice informative program going on. I think I learn a lot interacting with the people too. So it's always a learning curve for me too. But yeah, definitely, it was really good, and I'm very thankful to Ms. Sapna ji. She's putting a tremendous efforts into this thing. And I don't know how many sleepless nights she's having, going every day. I heard that this program is on a daily basis every day,
Yes,
and
yes,
it's
yes,
a lot
sir,
of work.
yes,
It's a lot of
I
work.
told you, she's a very
Right.
smart and active lady, very active lady.
Right, right.
I keep on acknowledging her through messages also. Very smart.
Wow.
And let me tell you why, sir. We enjoyed because you answered all the questions so nicely. So people were encouraged, to question you, to have their queries answered by you. That was the main reason.
Well,
so it depended.
Thank you.
It totally depended on your way of explaining the things and answering their questions.
Thank you.
Okay, thank you once.
I appreciate.
Thank you, everyone. We are forgetting two names. First of all, I would like to thank you, Meenu Maheshwari ji. Without her coordination, we could not able to do this program. And secondly, Manisha Joshi ji. She is, teaching past 22 years and amazing faculty and HOD of English department. So I really thanks to Manisha Joshi ji, because from Deep Memorial, she was coordinating with me. Thank you very much, ma'am. Thank you very much, Charu Kalra ji. Yeah, thank you very much. And at the end कहते भी हैं, प्रार्थना से यदि अंत हो तो सब अच्छा होता है। मैं एक प्रार्थना के साथ में इस कार्यक्रम का समापन करती हूँ। बहुत सुंदर कार्यक्रम रहा, आप सभी का सहयोग मिला, उसी के लिए बहुत बहुत धन्यवाद। Thank you very much everyone, and a lot of question was there, really happy. Okay, let's start with the prayer.
मालिक तेरे बंदे हम, ऐसे हो हमारे करम, नेकी पर चले और बदी से डरे, ताकि हंसते हुए निकले दम। ऐ मालिक तेरे बंदे हम, है अंधेरा घना छा रहा, तेरा इंसान घबरा रहा है, अंधेरा घना छा रहा, तेरा इंसान घबरा रहा, हो रहा बेखबर, कुछ न आता नजर, सुख का सूरज छिपा जा रहा है, तेरी रोशनी में जो दम, तू अमावस को कर दे पूनम, नेकी पर चले और बदी से डरे, ताकि हंसते हुए निकले दम। ऐ मालिक तेरे बंदे हम।
Thank you very much. Thank you very much, Dr. Pramod Kumar ji. Thank you very much, Manisha ji. Thank you very much, everyone.
Thank you, Sapna ma'am.